I'd like to convene the Ways and Means Committee. We're going to begin, even though we don't quite have a quorum present, we will, I'm sure, shortly. And since we aren't taking any action this morning on House File 5, we will begin the testimony. And what I thought I would do this morning, we checked, and there's been 60-some people who have testified in the previous, 7 or 8 committees, Mr. Atkins?
Feels about that many, Mr. Chairman.
Yeah. So what we will do after the bill is presented, I'll just simply ask if there's anybody who has not had an opportunity to testify in one of the previous committees. We'll have an opportunity this morning to make a few comments. We will take action on the bill tomorrow evening. And the reason that this morning we're doing an overview is because the bill isn't formally before us until we adopt the committee reports during the floor session today. And rather than meeting this evening, we want to make sure we abide by the 24-hour rule for any potential amendments. So we will be meeting then tomorrow night at 6 p.m., I think, and that'll be in room 5. So that'll be a different room, but that's the nature of how busy things are right now. So, Mr. Atkins, Representative Atkins, if you're ready to present the bill. I'm just kind of curious, how many that are at least here now have been in one of the previous committees to hear the bill? Just about everybody. Oh, we got, okay, somebody shaking their head no, okay.
No, I don't think Carlos.
But it has had a lot of exposure, Representative Atkins.
Indeed, Mr. Chairman, it has, and I appreciate the opportunity to expose it one more time, I guess. I will focus my comments to Representatives Breinert and Mariani, who are the only two in the room.
We have a working group to get
there may be others joining us that haven't, but it's going to be a small number, I think.
And Mr. Chairman, I have actually, this may sound strange at this point, but I very much appreciated the testimony that witnesses have provided to date. As you said, there have been 60-some testifiers, and I don't know how many amendments between the House and the Senate. I'm told it's well in excess of 100 amendments that have been proposed. And some might suggest that that would be frustrating to me. If anything, I think it's a sincere effort by most to try to improve the bill, and we have made some terrific improvements in the bill that would not have been provided for if we hadn't been through the very significant committee process that we've been through. For folks who haven't followed this, Minnesota will have a health insurance exchange. The only choice that we have is whether it will be a Minnesota-grown run here in Minnesota, controlled here in Minnesota, or whether it will be a federal exchange that will be imposed upon us. What an exchange is it's an online marketplace where people can shop for their health insurance in an apples-to-apples competitive fashion. The various carriers will place their products in the market, and consumers and small businesses, entrepreneurs will have an opportunity to shop for their health insurance in that marketplace. The differences between a federally imposed health insurance exchange and a Minnesota kind of homegrown version are several. There's certain questions that we just simply don't have answers to relative to if it's a federally imposed one. The one thing we know, though, is that if we don't do a Minnesota version by March 31st of 2013, that there will be a federally imposed one upon us. The federal version, in terms of how it would be, how the plans would be, or the products in the exchange would be selected, frankly, we don't quite know yet. They have not given us guidance in terms of if it was a federally imposed exchange. We just don't know whether plans would be allowed in or what criteria would be set. We've got very, very slim guidance from the feds relative to whether carriers would be allowed to have plans in there or not and how they would go about doing it. The Minnesota version, we have what's called the active selector model. I've compared it to a application for college. You get a lot of excellent students that apply to the Carlson School, and I've got a Carlson School grad over here to my right, where they get somewhere in the neighborhood of 7,000 applicants a year, and they accept about 400. Now, I'm not suggesting that we're going to get 400 health care or health insurance products in this exchange, but it's a very competitive process that we've set up, whereby we'd expect to get a lot of products applied for by the various plans across Minnesota, the various carriers, and the board then would go through and select the very best ones to provide for consumers to choose from. As far as how it would be financed, a federally imposed version would be a guaranteed 3.5% premium withhold. There is no wiggle room in that. It would be 3.5% of the premium no matter what. So if your family is paying $1,000 a month for their health insurance through that exchange, $35 each month would go to pay for the operations of a federal exchange. In Minnesota, we think we can do it less expensively than that. In fact, while the bill provides for up to 3.5%, which is the federal figure, our modeling shows that we can probably do it in the neighborhood of about 2 to 2.5%. We're hoping maybe even less, but right now the model that we've run, MIT's health economist, Dr. Gruber, has indicated to us we think we can do it at about 2.25%. So on an apples-to-apples comparison with the federal government, ours would be about 55% cheaper than what the feds are proposing. In terms of the board control, how it would be run, the oversight, quite frankly, again, we don't know how the feds would do theirs. We've got a little bit of slim guidance in terms of that it would be subject to audits and be subject to the Department of Health. What we know in Minnesota, and this is a piece that's been vastly improved as we've gone through the process, is that in addition to all of the federal oversight that is dictated by law for state-run health insurance exchanges, we've imposed several other pieces to that. And for example, and I think the most important thing that has emerged in the process is that it would be subject to and reviewed by Minnesota's own legislative auditor on an annual basis. And I think on a bipartisan or nonpartisan basis, we all have a great deal of respect for Auditor Nobles in his office. And it was a Republican amendment that provided for that suggestion, and I took it, and I think it's going to make for some very significant oversight over this board, this hybrid-type agency that we're establishing. The final piece that I wanted to talk about in terms of the comparison between a federally run exchange and a state-run option, if you opt for the federal version, as far as data practices and privacy, frankly, we don't really know what we're getting. Again, we don't have much guidance from the feds in terms of how they will protect private data, and that, to me, is kind of scary. In Minnesota, and I don't take credit for this. I look to Representative Holberg and Chair Simon and the members of their committee. They have offered us significant improvement in the bill that protects people's privacy. I will let, to the extent there's questions, quite honestly, I'd rather have Representative Simon or Holberg visit with you about the improvements that we've made to try to protect people's privacy in the bill. I'm much more comfortable with it now than I was at the outset, and it's a credit to the bipartisan efforts of the Data Practices Subcommittee. Those are some of the differences, Mr. Chair, between the federal imposed version and a state option, for obvious reasons, most of which is we've got good, sound answers, and I'd much rather have a locally run and guided exchange over which we have control rather than one over which the federal government has control. We have a lot at stake here in Minnesota by just about every estimate, every ranking, every study as one of the best healthcare systems, or if not the best healthcare system in the country. And to the extent that this will impact it, I'd much rather have it here where you dial a 651 number or 218 number to contact people in charge rather than dialing a 202 number in Washington, D.C. if you have a concern about it. With that, Mr. Chairman, I'd be happy to take any questions members may have, or if there's others who haven't testified, as you indicated, would like to be heard, I'd love to hear from them as well.
Yeah, there's, for some time there has been a quorum present, so I'll officially convene the the meeting, and then we have the minutes from our previous meeting. I think I see Representative Simon doing a lot of paperwork there. Have you had a chance to look at the minutes?
I have, Mr. Chair, and I move approval of the minutes.
Okay, Representative Simon moves approval of the minutes. Any discussion? Seeing none, then all those in favor signify by saying aye. Aye. Opposed? Motion carried. What we'll do is, if anybody has any questions of Representative Atkins at this point, and then we also have Barb Julich will give us an overview of the fiscal note that's in the packets as well. So why don't we start with questions of the chief author. Representative Anderson.
Thank you, Mr. Chair. My question will probably be for Ms. Julich.
Oh, okay. We'll put you down first for when she's done. Any questions of Representative Atkins?
They're all tired of me, Mr. Chair.
Well, we did have a show of hands for those that arrived a little bit late as to how many had been on a committee previously to hear the bill. And it looked like an overwhelming percentage of the people have been, so that's probably the reason. Well, then let's go.
Mr. Chair, I'm assuming that our meeting tomorrow night is not time constrained. Is that correct?
Well, there is a time constraint in the sense that we have to adjourn by midnight, if that's what you mean. Yeah.
Right, but
No,
we'll have the ability to
we'll-
ask questions tomorrow night.
Sure.
All right.
Yeah.
Thank you.
I'm hoping that we're not running till midnight. Okay, so there are no questions. Welcome. And if you want to go over the fiscal note then for us.
Thank you, Mr. Chair and members. My name is Barb Julich, and I am the Finance Director for the Exchange. You should have before you the 6E version of the fiscal note, which was the same note that was reviewed in the Tax Committee. The amendments from that committee did not change this note. I think probably it's a very long and complex fiscal note, but I think that the way I've been doing it in other committees, if it would be okay, would be to start with the summary sections for the exchange and kind of revert back to how those numbers in the summary sections were arrived at.
That'll be
That would
fine.
work?
It worked in the
Okay.
other committees. I'm sure it will here.
So then I would refer members starting on page 18 of the fiscal note. What you'll find on page 18, members, is the beginning of three tables, table 27, 28, and 29. The way the fiscal note is set up, it is based on three different enrollment assumptions: a high enrollment scenario, a medium enrollment scenario, and a low enrollment scenario. And so these tables reflect the cost and revenues under each of those scenarios. Some of the numbers do not change under either scenario, and some that are more sensitive to participation levels will change. So the first line item on the table is the personnel cost, and those can be found on table 11 of the fiscal note, which is on page 12. So what's reflected on page 12 within table 11 is the variety of staff positions, summary of the staff positions that would be estimated to be part of the exchange. It includes 29 information and technology positions, and then up to 57 more operational positions. This includes executive office staff, such as a chief information officer or a chief financial officer, chief legal counsel, things like that, plus supportive services such as HR, financial management, procurement type staff. And then a number of business operation positions, which are detailed in Table 9. This would include appeals, the plan management or quality measurement and reporting area, eligibility for the tax credit, individual eligibility area, the small business opportunity program or SHOP, a customer service area, communications and outreach area, stakeholder relations, and then the navigator broker program area. So a number of business operations would be set up within the exchange. Again, all those positions are summarized in Table 11. based on estimated salaries and fringe costs for those. What you'll notice is those costs start midway through fiscal year 15. It is assumed that up until January 1st of 2015, those costs would be covered by current federal grants. All these positions are mirrored to current positions we have outlined in our federal grants and would just assume to be continued under the new funding structure beginning January 1st, 2015. The next set of costs in every table is the support cost. Those are found on table 12 at the bottom of page 12. And these are basic standard calculations for supplies, your computer licensing agreements, rent, printers. We'd have some IT costs in here for data center hosting, some security-based training, and things like that. So kind of some of your standard miscellaneous costs that are based on per FTE cost, and then some unique things for the exchange, such as the data center and some of the security-based training. The next line item in the summary tables are the contract costs, which are on page 13 under table 14. We're estimating a number of outside contracts in order to have information to run the exchange. This includes contracts for a quality rating system. This would implement an annual analysis of data for the quality rating systems that we are required to have. We'd have annual training that would need to be done for brokers, navigators, county workers, and the such. The current grant does include some large initial training. There's some initial training paid for under the federal grants. This line item here would represent just ongoing changes to that training, any curriculum changes that would need to happen. Attorney General fees are budgeted here. We'd assume to have a marketing and outreach program with estimates shown here. And then just printing the communication materials shown here as well. The next line item is the IT infrastructure costs, which I'm kind of going backwards. That's actually on table 13. There's two main items here. One is infrastructure, the basic infrastructure. This is all the hardware and software and service installation contracts that we've had to engage in to set up the infrastructure. These are your and I'm not an IT person, but these are your operating licenses, if you will, your data racks, your servers, things like that. And this number is based on the current federal grants include a number of purchases for hardware and software and installation agreements. These would be your annual updated license agreements for these purchases or your maintenance agreements for these purchases. And this number is based on, depending if it was hardware or software, either 25% or 30% of the original purchase cost, which is kind of that annual IT standard of what these maintenance agreements would be. The second line is actually the marketplace tool. This is what we're building to do the eligibility determination, to do the plan comparison work, to do the financial management, tracking, the billing, and collection. So these are the license agreements with the vendors building the tool. This would be the annual cost of that license agreement that we have in place, and that's about $3.3 million a year. The next line item is customer service, and this is where the three tables will start to vary. This is very sensitive to the enrollment within the exchange. And so on page 14, starting with table 15, there's a number of numbers there. The exchange is utilizing a few things within here. One, we had an analysis done by Dr. Gruber out of Massachusetts that Representative Atkins referred to project how much enrollment we would have in the exchange by 2016. That number was then put into a budget model by the Wakely Consulting Group that would help estimate what the phase-in from 14 and 15 up to that final 2016 number would be. And based on that phase-in, it used the Massachusetts experience to come up with a per member per model cost for certain customer service activities. This would include eligibility activities, other type of navigator or in-person assistant activities, customer service such as call center, notices, things like that, appeals, and then premium billing and collection, sending out invoices, collecting invoices, and reconciling them. So based on that model, again, a per member per month cost was developed. That cost was then calculated against the member months from the model to come up with low, medium, and high estimates within each calendar year. And the results of that then are shown in tables 16, 17, 18. based on the enrollment scenario. So under the high scenario, the total estimate, and I'll just use fiscal 16 because that's a complete fiscal year, for these customer service type activities was $30.7 million. Under the medium scenario for fiscal 16 is 24.4, and under the low for fiscal 16, 17.1. And so these numbers then carry forward to each of those subsequent summary tables starting on page 18. The next item is other agency costs, and that is found on top of page 18. There are fiscal note or other agencies included in this fiscal note include the Department of Commerce, Department of Administration, Department of Health, and the Department of Human Services. And without going through the specifics of their fiscal note, because I would have them talk to their own fiscal notes, but the construct of this fiscal note would be those costs would be covered by the exchange and reimbursed to those agencies. So this table reflects the other agencies' costs coming into the exchange. Their individual fiscal notes reflects they're receiving a revenue to perform these services from the exchange. And for the Department of Commerce and the Department of Health, it's primarily the regulatory activity around the plan management. Department of Administration, it's primarily some assistance setting up administrative procurement policies and the like. Department of Human Services, it is directly tied to some training activities for navigators within the bill. The next item is cost allocation to Medicaid. Within the fiscal note, that starts to be displayed on page 16. There's a couple of activities that go on here. One is during the time period we are under the federal grants, we are utilizing the grants that have been submitted. We're utilizing the April 2012 Gruber estimates of participation between Medicaid and non-Medicaid within the exchange. And those ratios are shown on table 23 under the fiscal 14 July to December column. And so we would be proposing, since those grants have already been submitted, that's the formula we'd be using for that time period. However, after that, we'd look to updated figures. And so this fiscal note just uses the most recent figures of the January update from the Gruber file to estimate what those ratios may be against the Wakely consultant model for low, medium, and high enrollment estimates. And so for different activities, we'd have a different allocation ratio. For example, on individual eligibility, we'd only be looking at the proportion of Medicaid against all individuals, not including small business. And so the small business participation would be taken out of the denominator, and that's how that cell is done. For non-MAGI health care, this would be 100% allocated to Medicaid. For all other items where the benefit is for the whole program, the ratio would include the Medicaid over all participants, including SHOP, and so that's the third line item there. For items associated just with SHOP or just with premium aggregation, there is no Medicaid benefit to those, so those activities would not have a Medicaid allocation. And for IT infrastructure, again, it's that broader participation, so you'd have a broader allocation there. Post-grant activity in Table 24 is very similar. Again, it's just taking those that same analysis, but for a different enrollment scenarios for calendar year 15 and calendar year 16 from the Wakely model. So again, applying the calculated ratio of Medicaid over total participation against cost of those activities identified in the left-hand side of the column, you come up with what's in Table 25. So the results of that calculation are shown in Table 25 for high, medium, and low enrollment scenario, and then those Medicaid costs would be allocated to DHS and be reimbursed to the exchange, so they would be netted out of the exchange cost prior to calculating what the premium withhold would need to be in the bill. And so you'd see on the summary table, you'd see the total of cost. After all these activities, you'd have the total cost, and again, under the high enrollment scenario, For fiscal 14, 7.6. For fiscal 15, 28.6. And then 57.4 and 60.7 in fiscal 17. Off that, we'd back out the numbers from Table 25, because that would be allocated to Medicaid. You come up with a net cost, and again, focusing on fiscal 16, net cost of $48 million. And then from there, the fiscal note will assume what kind of revenue would be needed to sustain that level of expenditures. The revenue allocations begin on page 15 of the fiscal note. Again, taking, as stated before, the enrollment estimates for 2016 from Dr. Gruber, the Wakely model, which is backing down what the 15 and 14 estimates would be, and then further breaking them down into what the member months for each of those calendar years under each of those scenarios would be. You get the top of Table 19, the member months for individual, small group, and total. That total is then broken up from January to June and July to December in order to make this a fiscal year equation. And then, as stated before, based on the level of expenditures within each year and the caps put in the bill regarding, there's language that says within for amounts collected in calendar year 14, it cannot exceed 25% of the MSHA collection in 2012, which is assumed to be around $160 million. And calendar year 15, it can't assume 50% of the MSHA amount. And then in calendar year 16, it can't be more than the amount collected in 15 plus an inflationary rate, which is assumed to be 1.64 based on the current forecast. And then in ongoing years, it's assumed to be 1.84, again, based on the current November forecast. So looking at those caps, the estimated percent on the top of page 16 was used to calculate the revenue for each year that is then shown on Table 20, 21, and 22. And then those numbers are brought forward into Table 27, 28, and 29, where you come up with an annual balance and then a cumulative balance for the fund within there. And Mr. Chair, I'd be happy to stand for questions.
Okay. You referenced other fiscal notes that had been prepared, necessary to have comments by those folks, or just if they happen to be questions. I wasn't sure what you meant by that.
Mr. Chair, I think, for the most part, I think the Commerce and Health fiscal notes are based on their estimate of staff they would need for the regulatory to be able to continue their regulation duties over the carriers. The Department of Human Service fiscal note basically takes that Medicaid allocation and breaks it into a state share versus federal share. And so you'll note on the very front of the sheet of the fiscal note, you'll have a general fund human service line of 1.841, 2.618, and 3.280, et cetera. That reflects the state share of those Medicaid lines that were in the exchange fiscal note. The Legislative Audit Commission, there's language in the bill requiring the exchange to pay for a review by the Legislative Audit Commission on duplicative services, I think. And so you'll see the $45,000 there, but you'll also see down below under revenues, they would get $45,000 from the exchange as a reimbursement for that. So it's different funds, but it nets out to zero. And the other piece under Human Services Special Revenue, again, back toward the top of the summary sheet, is that $250,000 I had mentioned within the other agency fiscal notes. That's for that navigator training. Again, that would come from the exchange. There's a revenue under the revenue side for human services for $250,000, so that would net out to zero because those costs would be borne by the exchange.
Okay. Thank you. Representative Anderson.
Thank you, Mr. Chair. And Ms. Julich, last week when we heard this proposal, I had asked for an updated cover sheet that we have here on the fiscal note, because this is based on the high enrollment.
Correct.
Have you had a chance to get both the medium and low enrollment scenarios for this cover sheet here for the fiscal note?
Mr. Chair, Representative Anderson, I apologize. I guess I thought the request was for low. So the low enrollment scenario was sent this morning, and I can certainly do the medium.
That'd be great.
Okay.
And then one more question, Mr. Chair.
Representative Anderson.
I also noticed on here, when we had conversation last week on this, you talked about that personnel would be adjusted based upon the enrollment. Yet when you look at tables 27, 28, and 29, the personnel costs are the same for each enrollment scenario. Can you tell me why that is?
Mr. Chair, Representative, I think the last week when we were looking at the customer service levels, and to the extent that that would be highly sensitive, and so how many call center reps would you need depending on the level of participation? So I think that's where the variability came in, and not on the personnel side.
Mr. Chair. So regardless of what the enrollment is going to be, we're still going to have 83 positions in fiscal year 14 and going up to 84 the next year and 86 the next year, regardless of what the enrollment is going to be?
Mrs. Gillett.
Mr. Chair, Representative, that is the assumption in the fiscal note. It's based on most of that to support the programs, to support, under, for example, under the Navigator Broker program, you'd have a set of liaisons for outreach to brokers, business reps, not the right word, but, someone for brokers to call. I think under any enrollment scenario, that's going to probably be similar to, some of the support services cost will be similar. Some of the operations, under operations customer service, we'd have a link to one staff person linking to the call center. The call center staff may go up and down based on enrollment, but that central office position coordinating with them would be the same.
Mr. Chair.
Representative Anderson.
Ms. Julick, do you think by tomorrow we could get a better breakdown of exactly what these positions are from the executive office of 8 people, support services of 13, business operations of 33, IT of 29? If you could get us a detail of that.
Mr. Chair, Representative, actually on page 10, starting on table 7, 8, 9, and 10 are the individual positions are listed.
Yep. Thank you, Mr. Chair.
Hey, Representative Dean.
Thank you, Mr. Chair. And Ms. Julick, last week when we were in health, we were talking about the Gruber-Gorman report and the April 12th version that we were working off of, and had discussed an updated report upon which several of the assumptions within the latest fiscal report dated 2/21 are included. They had gotten the initial data to MMB, but they had not gotten their report to MMB. And I was just wondering if they said that the numbers were there, but not the wraparound text or something like that. And I'm just wondering if that is currently available, and if so, when we might be able to see the updated report.
Mr. Chair, Representative, it's my lifeline says by the end of the week.
Thank you, Mr. Chair and Ms. Julick.
Representative Dean.
I think what a lot of the there's been a lot of trail through committees that this bill has taken, and I've only seen it in health finance, but I've tried to pay attention to it and actually looked at some of the other tape from the committees. And there's a couple of things that I think are of interest. Number one is that there's not a lot of questions. Representative Carlson said, are there any questions? And here you got the committee chairs of a lot of the finance committees, and there's not a lot of questions. It's a 12-page bill that affects every Minnesotan, and it affects health insurance, it affects health care, it affects delivery, it affects prices. But you got a 12-page bill and a 50-page fiscal note, and we're moving very quickly. And a lot of other states are wondering why. The biggest question that I have is on the fiscal note is page 8, section 6. and everybody should look at this if you don't look at anything else in the fiscal note. It talks about the comparison between what's in the marketplace and what's outside the marketplace. And maybe this is for Representative Atkins, because I'm sure this has been where a lot of the testimony has been. But when we look at how we're operating within the market, within the health insurance exchange and outside of the health exchange, we're looking at the market within and the market outside. And the marketplace really contradicts itself when you're talking about management both within and outside of the marketplace. Does the assumptions in 6, when we're looking at this, shouldn't the primary goal be to lower the number of people who are uninsured? But when I look at 6, this is really the thing that really bugs me the most. Aren't we competing with the outside of the market, and aren't we trying to manage that by rates? And I think in subdivision 6, that really says that that's what we're trying to do.
Representative Atkins.
Mr. Chair, Representative Dean, not to answer a question with a question, but I'm not tracking what you keep referencing Section 6. How do you believe that Section 6 does what you've just described? I'd be happy to respond once I get a sense of where you're coming from.
Well,
Representative Dean.
when we're talking about pushing enrollment through the marketplace, we're competing with the rest of the market. And I think that I never really noticed it in the bill. But a lot of the questions that I've heard from other committees have really been about that, and about manipulating the number of people outside of the market. And that's really, I think, the biggest question that I have. And I wanted to ask you about it in Health Committee afterwards, and I wasn't thinking about it. But, I mean, shouldn't the goal be to primarily lower the number of uninsured and not manipulate the market outside of the exchange?
Mr. Chair, Representative Dean, I'm still not tracking exactly how we're manipulating the market outside the exchange. What we are offering here is a marketplace where consumers and small business folks can go and buy health insurance. And we'd invite products or carriers to apply and provide their product offerings. We'd place those in the market and people can buy them. I don't know how that necessarily manipulates the market outside. We're just talking about what would be available online so that people could shop in an apples-to-apples way for a product that meets their needs.
One other question I had is, I think from Representative Anderson kind of alluded to it earlier, within the number of FTEs. I think we've got 86 FTEs. 38 of them make more than $90,000 a year. And in Table 27 of this, on page 18,
I'll sit there. I'm not going to be back.
why are there no cutbacks in these positions, particularly in the navigators? If things aren't really hitting too well, I could kind of see that. But if things are going well, it seems like the FTEs seem to grow no matter what. We don't, even under the different scenarios. That's kind of the question that I had. And maybe that's something that I just didn't quite catch. Ms. Julich?
George?
Mr. Chair, Representative, the way the FTs are structured, these aren't the FTs who would have that one-to-one contact with the participants. That would be more in the customer service end. But you still need that central office management of that program. And so you'd have kind of a core central office activity that would manage and oversee the policies and procedures around the program, but the operation of that customer service size would fluctuate within that customer service dollars. Yep.
Thank you.
Representative Khan?
It's not on this issue, so. Are we finished with this one?
I think we're finished with that issue.
Okay. One of the things I noted was there was a cost to the legislative auditor, Legislative Audit Commission, on page 1 of 47. That's correct. Mr. Chairman, one of the things I've been proposing, at least for parts of the legacy budget, is that unless we're willing to just routinely increase the budget for the legislative auditor, what I would like to do is whenever there's a special program that has an appropriation attached to it that's going to require additional legislative auditor expenses, I'd like us to add that additional money to the legislative auditor, to the, to the budget, because it's clearly not planned for, because they don't know if this bill is going to pass. And I think that's a really good way. I think if there's anything that we kind of uniformly agree on in this place is that the legislative auditor does good work no matter who's in charge. And so I would like, I don't know if you want an amendment to do that, but I don't know if that's the only place where we're looking at increased costs to the legislative auditor. And I don't know if Ms. Representative Atkins, you've thought about that at all. It's obviously a very small amount when we're looking at the total budget, but...
Well, Mr. Chairman and Representative Khan,
Atkins.
not only did we think about it, we thought it was such a swell idea, we did it. It's on, I believe, page 31 of the fiscal note, was to plan for, if I'm understanding your question correctly, I just confirmed with Ms. Julich that we in fact plan for that, if that's...
Representative Khan's talking about that 45,000.
Yes, and that's what we've got on page 31.
Yes.
Starting FY14, which is this. Does that address the issue that you raised, Representative Khan?
Well, you put...
Representative Khan.
Mr. Chairman, so that money to the general fund is covering that 45 that we're missing to the for the legislative order? Okay.
Mr. Chairman, Representative Khan, yes.
Okay, and is it specifically going to the legislative auditor? Okay, terrific. Thank you.
Okay. Let's see, Representative Holbert.
Thank you, Mr. Chair, and I only heard this in civil in less than 2 hours, and we were constrained and didn't get into any of the money questions, so my apologies for that. But I'm still not understanding how this saves money when you look at the tens of millions that it costs to build this. Do you have PMPM for the private sector? Do you know how this relates to their costs to administrate their programs? Are you in the ballpark, or given that you're setting up all this new infrastructure?
Representative Atkins.
Mr. Chairman, Representative Holberg, my understanding is that, and I would leave the PMPM in the private sector for them to answer for you themselves, but the one thing I know for sure is that there's going to be an exchange. Whether it will be a federally imposed one or a state-run exchange, there's going to be one. And my sense, based on the fact that we've been guaranteed that the federal exchange will be more expensive than a state-run version, I would suspect that the plans would tell you that their PMPM, based on absorbing a 3.5% withhold, would be higher than what we've proposed here, where we anticipate the withhold to be 2 to 2.5%.
Mr. Chair, but it's my understanding that there's going to be a good share of the health care that will not have to touch this exchange, that will not have anything to do with this. And I'm just wondering what their cost of administrating their programs are versus the programs administered under the exchange, both the ones available to the general public, small employers, and with my understanding that this is also administering the Medicaid program. So, I mean, the Blue Crosses of the world and the health partners of the world have to have some type of cost per patient overhead. And Do you have any idea what that is, whether you're even in the ballpark with the exchange?
Atkins.
Mr. Chairman, Representative Holberg, what you've described is absolutely true, that there will be an impact on the cost of delivery for the various plans. What I'm suggesting to you, and I can guarantee it, is that the cost, there will be this exchange, whether it's run by the feds or run by the state, and the federal version is going to be more expensive. Without a doubt, it's more expensive. And the impact on those, you're talking on the broader market of the costs of if those costs are passed through, those will be higher to those same entities as a result of a federal plan, because they have guaranteed that their arbitrary figure is going to be a 3.5% withhold, and ours will be lower. So those pass-through costs, to the extent that that occurs, and that's that has to be higher under the federal version than under the state version.
Mr. Chair,
Representative Holder.
I'm not talking about the federal version. My understanding, and correct me if I'm wrong, and I'm wading into a place here where I don't know the answer, which you're not supposed to do around here, but if I'm not part of the exchange, if I'm lucky enough to have an employer like the state of Minnesota that self-insures or whatever, and I don't have to ever go to this website, it never touches my life, because it's my understanding that there won't be a premium withhold on those plans because they're completely outside of this. There has to be a general cost of doing business. And what is that relative to the, whether we're at 2.2 or 3.8, just this general idea of how this is going to save so much money. I'm just seeing a lot of tax dollars being spent, a 47-page fiscal note. It seems like a lot of extra money and a lot of extra steps to me. Is there any comparative analysis with the private sector?
Representative Atkins.
Mr. Chairman, Representative Holberg, not that they've shared with me from in terms of their costs. The reason I keep coming back to the fact that the impact of a federal exchange is because it's exactly the same whether it's a federal exchange or a state exchange. Certain costs will be imposed to folks that may not benefit from the exchange, is what I think where you're going with this. And the fact is that if it's a state-run version, we know we can do it less expensively than if it's a federally imposed one, because the feds have already said their cost is going to be higher.
But, Mr. Chair, maybe I'm misunderstanding. Is that 3.8% tax, the federal program, is that on all plans or only plans within the federal exchange?
Mr. Chair, Representative Holberg, just as I understand it, and I'll look to these folks here from the exchange, the 3.5% or our 2.25% will be applied exactly to the same exact folks. So all it is just a matter of we think we can do it less expensively than what the feds are saying that they are going to impose.
But I'm still not. Is it, let's go back to the Sesame Street version here. Is it true that some people buying health care in the United States will not buy it through a health care exchange, federal or state?
Mr. Chairman, Representative Holberg, it is true that some folks across the United States and in Minnesota will not buy their insurance through the health insurance exchange, whether it's federally imposed one or a state imposed one.
All right, so now let's go from A to B. Is it true that those people that have the ability to buy insurance outside of the state exchange, whether it be federal or state exchange or co-ops, will their premiums be subject to this premium tax, either the 3.5% or 3.8% at the federal level, or the wonderful 2.2% tax in Minnesota?
Representative Atkins.
Mr. Chairman, Representative Holberg, the impact on premiums outside is exactly the same whether it's Minnesota or federal. It's just that Minnesota is at 2.25% and the feds are at 3.5%.
So, Mr. Chair, so this tax would be put on all plans, whether you're within the exchange or not?
What we might be, Mr. Chair, let me look to Ms. Julich for a moment, because we've got, in the initial outset, or Ms. Momlov, we're establishing a reserve as well, which is at 3.5%, and what she might be able to specifically talk to you about the impact on plans that are outside. where I'm losing you a little bit is that the plans have represented, and I'm trying to be true to what they've said because they're not testifying anymore. They have indicated that there will be, as a result of certain costs being assessed inside the exchange, that up to 3.5%, that they anticipate that there will be an impact on costs of products outside the exchange. And I'd rather have Ms. Baumlove perhaps give you a specific to your point.
If you could identify yourself.
Mr. Chair, members of the committee, my name is April Todd-Mulma, the Exchange Director. So, Mr. Chair and Representative Holberg, to your question, the 3.5% or the 2.25% that's assessed, either whether it's at the federal level or at the state level, would just be assessed on those plans participating inside the exchange. How the distribution of that cost is distributed at a carrier level, both whether it's through the federal exchange or through the state exchange, is up to the distribution of the carrier, how they want to distribute that amongst their book of business. The one example that I would give you that I think is helpful to kind of understand how it could be distributed is that it could be distributed in the same way that carriers distribute broker commissions, for example. So not everyone that buys a health insurance policy uses a broker. But whether someone uses a broker or not, they get charged the same premium as a consumer, whether or not they use one. So internally, the carriers can distribute that broker commission, what they pay, amongst their products, depending on which brokers help with which products more often or not. And so that could be the same way with the exchange, where there are some services that the exchange is providing, for example, that the carriers will no longer have to provide, for example, premium processing. So they can distribute that cost depending on where the use is. But some of the services are going to be new that aren't in the market today. For example, determining individual eligibility for tax credits. That's not something that's in the market today, but the plans are getting many more thousands of individuals enrolled in their coverage, and so they could just assess that to that side of their business. So it's really up to the carrier how they want to distribute that administrative costs along their book of business.
And if I might, I wasn't able to hear the testimony from the insurance companies, I think what you're calling carriers, but you stated that there would be, that they testified that there could be an impact on the cost of products outside of the exchange. Can you enlighten us a little bit? Because that sounds to me like even if you're outside of the exchange, you could be paying more.
Ms. Mulval?
Mr. Chair, Representative Holberg, I really think that's a question for the plans. It's really, they have the leeway to distribute that administrative cost amongst their book of business, how they choose to do so, as they do today with broker commissions, whether or not someone uses a broker or not.
And
Representative Holberg, it would be I initially said we'd be taking testimony from those that haven't had an opportunity, but as always in this committee, if there's somebody in the audience you'd like to pose a question to, we can do that.
Well, and Mr. Chair, I know we're coming back tomorrow night, and I'm assuming that I'll be able to get additional information. Maybe have questions that I actually already have the answers to by then.
However you want to approach it, I just wanted to offer that opportunity if you wish.
All right, and I appreciate that. So if I can just ask one more question. If you are of a low income, so you're going to be able to get some kind of tax credit or benefit, do you have to go through the exchange to get that tax benefit, or will you be able to purchase insurance in the free market and still get that tax benefit?
Mr. Chair and Representative Holberg, yes, you have to purchase through the health insurance marketplace in order to secure the tax credit.
All right, thank you.
Hey, Representative McNamara.
Thank you, Mr. Chair. I am one of those members that hasn't seen this yet, so maybe some of my questions will be pretty basic. Representative Atkins, I'm curious, in the low, medium, high, different numbers, what percentage of Minnesotans are estimated that have or will have health insurance will buy it from the exchange?
Representative Atkins.
Thank you, Mr. Chairman. Representative McNamara, under Dr. Gruber's estimates, it's anticipated that up to around 1.3 million Minnesotans will eventually purchase their health insurance through the health insurance marketplace, the online version. Of those, currently about 300,000 are uninsured, and obviously it's subject to, I don't expect on January 1st for 1.3 million Minnesotans to enroll that day. I sure hope not anyway, or we'll be a little overwhelmed. But that's the figure that they eventually expect. So about 1 in 4 Minnesotans would purchase their health insurance through this marketplace.
Thank you.
McNamara.
Thank you, Mr. Chair. And then Representative Atkins, how does this help those folks that currently buy in the private market, whether they're a small business or a lay person or whatever? How will this system be better than the current one that they do today?
Representative Atkins.
Mr. Chair and Representative McNamara, speaking on behalf of a small business, right now, frankly, we don't feel like we have a whole lot of leverage with which to negotiate with health plans. So it would be nice to have, on a competitive apples-to-apples basis, an opportunity to shop for that health coverage that meets our business's needs. The anticipated savings as a result of having that increased competition is about 7.5% annually. For consumers, one of the benefits that they'll have as a result of this, as was alluded to with Representative Holberg earlier, is that they can avail themselves of the tax credit, in addition to enhanced competition. And by putting those two commodities or those two elements together, it's anticipated that the average Minnesota family will save about $490 a year on their health insurance. Some will save more. Some, if my family, for example, were to purchase it directly through the marketplace and not through our business, we wouldn't likely save anything because we wouldn't be eligible for the tax credits. But I think everybody benefits from some good, robust competition where the carriers have to fight to get our business.
Representative McNamara.
Oh, thank you, Mr. Chair. Representative Atkins, I'm a little confused. So if we get the government involved, we're going to have more competition. There's going to be more competition in the exchange than the current open market today. Did you say we're going to save money because we'll have more competition if you buy it from the exchange than the open market?
Mr. Chair, Representative McNamara, I think you always benefit when you have greater competition. And right now we don't have that in an online setting. A previous version was tried that wasn't very effective and didn't have these elements to it. But right now I'd suggest to you, and the plans may have a little different perception, but just speaking on behalf of a little small business and as an individual, I'd say that the competition is not all that keen among the carriers. And that, yes, I do believe that having an online opportunity to see in an apples-to-apples way, in a comparison way, shop for health insurance, I think is going to help a lot.
So thank you, Mr. Chair. And Representative Atkins, today in Minnesota, I think basically we have, if I remember right from my buying health insurance when I was a small business owner, we don't allow for-profit health insurance companies in Minnesota. Am I right on that?
Mr. Chair, Representative McNamara, that is correct. This would potentially allow for, and will allow for, at least 2 federal plans to also participate in the online marketplace. And I suspect that, we're going to get more competition in that marketplace than we've ever seen in Minnesota before.
Okay. Thank you, Mr. Chair. So, Representative Atkins, if I understand right, currently we've got 3 or 4 big players that are nonprofits and operate on a pretty small margin of money currently when we buy in the open market, whether I think we're the state of Minnesota or whether you're a little landscaper or a little law firm. Currently, we work with an agent who's maybe been in business for 20, 30 years, gets to know our small company, the landscape company, or the law firm, and understand who the participants are. And we work with health insurance companies that operate on a really small margin of profit. I've heard numbers of 1% or whatever. I'm trying to understand, so now we're going to let companies like United Health, Time Insurance, potentially, and I can't think of the other one that's really got an egregious record of denying claims. And we're going to work with somebody called a navigator online. So if I'm a small landscape contractor making my living planting trees, I'm now going to go online and work with a navigator and have the confidence instead of going into the private market and working currently. I'm just trying to understand what's going to make me jump online and want to go do this deal when it seems like in Minnesota we kind of have our act together today. I'm not following where we're headed here.
Mr. Chair, Representative McNamara, let me try to help a little bit, because you actually had a number of
Representative Atkins,
situations.
excuse me, I'm always worried when the landscaper's getting helped by lawyers. Just kidding.
And, well, I'm actually always pleased when the lawyers are getting helped by landscapers, so I appreciate the question.
Not getting their hands dirty.
The navigator versus agent issue, first off, the agents and brokers are not, they're not pushed out as a result of this. In fact, speaking on behalf of my small business, we've got an agent that we like a lot, and I would expect that we'd continue to work with him to help us with these decisions. But it can only be enhanced by the fact that we've got an online opportunity where we can see all of these products competing against one another and only enhance what our agent is able to do. The navigator now, keep in mind that the navigator is not an agent or a broker, and they can't be giving you professional advice. You can work with the navigator to help you work your way through. I don't know that you'd buy it on this little device here, but they can kind of guide you through the site, but they're not, sure as heck, aren't supposed to be given any sort of professional guidance or advice on what product fits your needs. They're just trying to help you navigate your way through the online marketplace. You also noted that you didn't want certain folks selling bad products and they took advantage of people, and I don't either. And we have in the Department of Commerce, they're kind of, for insurance products, they're like the FDA. And they're not going to let anybody sell in Minnesota and anybody that tries to sell something in Minnesota that isn't a good product. Either they're not going to let them in the first place, which would be about 97% of the time, but then to the extent in those other, maybe it's a 0.5%, where they try to cheat people anyway, the Department of Commerce is going to come down on them like a hammer, just like they have in past situations here in Minnesota. They are not going to let folks take advantage of Minnesota consumers.
Well, thank you, Mr. Chair. So Representative Atkins, so what is the gist of why will the small employer want to go to the exchange instead of what they're currently doing today? What would be the big reason of why? Assuming they're not getting some tax credit that we make them go to it, why would they want to go to a state plan today or tomorrow when it happens?
And Mr. Chair and Representative McNamara, I'm really glad that you brought that up because that is a point that I haven't made very well. This is not a state plan. In no way is the health insurance online exchange a state plan. There are no state plans. There are no government-run plans. It is all solely products that health carriers here in Minnesota would offer through this online marketplace, where you could literally have them lined up for you, apples to apples. They're literally competing against each other online to get your business. That's what this is. So the Blues and the Medicas, we've actually got 11. I know there may be 3 or 4 big ones, but we've got 11 different carriers in Minnesota. And my hope is that not only the big ones are going to get in, but it'd actually be easier for those little carriers to offer their products in this exchange and really compete in a robust way for your business. It's those folks that'll be in this marketplace, not any sort of government-run plan.
Thank you, Mr. Chair. Representative Atkins, I used the wrong word. I used plan. I should have used exchange. So do those 11 already operate in the market today?
Mr. Chair, Representative McNamara, to various degrees, yes. All across Minnesota, some are in certain markets, some are not. And it is a little bit more challenging if you're small to compete against some of the big folks, but hopefully this will aid in that healthy competition.
Thank you, Mr. Chair, and I appreciate the patience. I hadn't seen it. So I am understanding a little better now. These people that are already here are still going to be here. Government's going to get involved. We're going to hire 80 people, and we're going to make it easier for those people to do it with more government involvement. We're going to save money doing it. I think you said $490. Was that per each individual, or is that for the group plan, or what was that $490?
Mr. Chair and Representative McNamara, that's a figure that Dr. Gruber, who's an MIT economist, anticipated that the average savings per family would be in Minnesota as a result of buying through the exchange. Between the competition and the federal tax credit, that their average savings would be about $490.
And Mr. Chair, if I can ask, just what's the savings if you're not on the government, if you're not counting the tax credit? What's the savings that the average a small business owner will save by going to the exchange instead on the current private market.
Sure.
Representative Atkins.
Mr. Chair, Representative McNamara, my understanding is as a result of the enhanced competition, the average business savings would be about 7.5%.
Thank you.
Representative Detmer.
Thank you, Mr. Chair, and the author of the bill. So what we're saying is that a person can go online. Now, at what time will he have or a family will have face-to-face contact with an agent to go over the policies that they're going to be purchasing?
Representative Atkins.
Mr. Chair, Representative Detmer, anytime they want to, if they choose to follow that course. If they still want to have an agent or broker, they can absolutely do that. Nothing in this bill would prevent that. Some folks, now mind you, some folks may not necessarily want that, and they can also buy without an agent or broker being involved.
Mr. Chair.
Representative Detmer.
Now, you mentioned that there's 11 carriers in Minnesota currently, and how many will be allowed in the exchange?
Mr. Chair, Representative Detmer, all of them.
Okay. If they meet, Mr. Chair, if they meet certain criteria, am I correct?
Mr. Chair, Representative Detmer, absolutely.
Yeah. Now, if I'm not in the exchange, I won't be able to offer any the tax rebate to any of my customers. Is that correct?
Mr. Chair, Representative Detmer, that's true regardless of whether it's the federal imposed version or the state-run version, yes.
So actually the government is pretty much controlling the population in terms of getting into the exchange because of the tax credit. That's what it looks like to me.
Mr. Chair, Representative Detmer, I didn't make that federal law. I'm just dealing with it. So, yeah, we don't have, we're going to have an exchange, whether it's a federally run version that we have no control over or whether it's a state-run, homegrown version over which we do have some control, and I prefer the latter.
And, Mr. Chair, one last question. I've been looking through the bill. Is there any place in the bill that it says that health care will improve in Minnesota?
Mr. Chair, Representative Detmer, I may have misunderstood. I think your question, is there anywhere in the bill that says that health care will improve in Minnesota?
Correct.
Mr. Chair, Representative Detmer, no.
Okay.
I just want to ask, we should adjourn at 11:30, and I announced earlier that if there was anybody in the audience that hadn't had an opportunity to testify in one of the other committees, there's been 60-some people, and some of them have done it multiple times. Just let me get a feel if there's anybody that wants to testify today that hasn't. Because we do have some other members that have questions. Okay, apparently not, so then Representative Holbert.
Thank you. Mr. Chair, and Representative Atkins, part of the testimony today was that part of the fiscal note was based on Gruber's April 2012 numbers, and then they were updated in January of 2013. In general terms, how did those numbers change over that 8-month period?
Mr. Chair, it might, well, and I've got Ms. Julik here who's got the numbers right in front of her. Maybe she can answer that question, then I'll provide some editorial.
Ms. Julik.
Mr. Chair, Representative, the comparisons are on Table 1 on page 6.
And, Mr. Chair, I can certainly digest this between now and tomorrow evening, but we heard that the final report should be up by the end of the week. Will we have an opportunity to review that report before this bill comes up on the House floor?
Mr. Chair and Representative Holberg, we actually have, just so we're clear on 2 points. Number one is we have the final figures. The only thing that we're waiting for is the sort of the textual wraparound of it, but nothing is going to change other than in terms of what we got in January, and that was simply an update of the April report. And yes, we expect to have also the text kind of explanation of which I suspect will look very much like what we got back in April relative to the text.
And Mr. Chair, will that get posted somewhere, or will, I mean, is it due Friday, and is there a place where the public and members could find it by a certain time, or is it kind of like the forecast is coming out, or?
Mr. Chair, Representative Holberg, I plan on just sending it out to members. I think folks will probably be thoroughly underwhelmed by it, but I know it's something that folks have wanted to see.
And if I might, I'm
Representative
sure there might be members of the public and interested parties that would be interested as well. So thank you.
Any further questions? Well, seeing none, tomorrow evening, 6 o'clock, room 5, we will be convening the committee to take action on the bill. As I mentioned to members earlier, it was not in our possession. It won't be until the committee reports, but we did want to take advantage of the time slot and get a chance to ask questions and have a presentation. Amendments should be submitted to the committee by 3 p.m. on Tuesday, February 20th 26th.
Thank you.
Thank you, Mr. Chair.
If there's no further discussion, meeting adjourned.